debate is the flashpoint for a broader discussion that the country is having in the last election, and now we're going to have it again in the upcoming election, about what is the proper role of government. To what extent should government insert itself into industry sectors? To what extent should our local communities kind of hand over certain elements of our society and the mission of our society to government? Where is it effective and where isn't it? Where is it constitutionally required and where isn't it? So I think the healthcare debate, for all of its rancor, has actually been, I think, a really important discussion for us to have as a country. And politics can be a real noisy venture at times, and the rhetoric gets a little heated. So be it. That's what the process is, and I think it's good for our country to think about these things, because we've got some big challenges, and healthcare is right in the middle of that in terms of what we try to do as government versus what we leave for citizens in the private sector. I think we should parse that question. I think there's a legitimate role for state government to pick up pieces that the private sector and our local communities can't handle on their own. So in terms of, should government provide a single payer, all-inclusive healthcare coverage for every citizen, I don't agree with that. There are places, and Minnesota is frankly a leader in some of these places, where I think the state does have a role, and I'll give you an example. We have what's called the Minnesota Comprehensive Health Plan, MNCHA, you might hear it called. That is a plan where the state of Minnesota takes people with pre-existing health conditions who can't get insurance, and we pool those people and their health insurance risk, and we provide a state health plan. In my mind, that's a really good solution to the problem of pre-existing conditions and the costs that would impose upon the private market health insurance. So that's a place where I think we do have a legitimate role. I think there's discussions about, in terms of people at the poverty level or below, can the government help out with their health insurance there? That's another place where I'd probably agree that we have a role. But in terms of really taking over the entire healthcare system, no, I think that would be an intrusion, and we'd end up with a higher cost, worse product in the long run. A couple of things there. It's important, I think, for people to understand that GAMC, the General Assistance Medical Care Program, is a state of Minnesota program. We are the only state in the country that has this program, and it is focused on the lowest income single adults. So that's a place where I think many of us would agree that there's a role for the state to play. What happened in the state of Minnesota is, because this is a state-only program, we don't get any federal matching dollars. So it's very expensive to us at the state level, because we don't get the match like you do on medical assistance or disability, the things that are co-funded by the federal government. So when I looked at the cost increases, general assistance medical care was literally increasing at 35 to 38% in this budget cycle, and it was going to cost the state of Minnesota $900 million. You look at something that expensive and the cost increasing at that extent, and you realize that something is broken. So there were actually, for a couple of years, proposals to reform general assistance medical care that I supported that never got implemented. So we just kind of hit a brick wall here in this budget cycle. So I was very much in favor of reforming the program. The fix that we passed does a couple of things. Number one, general assistance medical care had overlapping eligibility with veterans programs, with disability coverage, and medical assistance coverage at the federal level. It also overlapped with our own MNCare program. So fix number one was to say hospitals should be able, when a patient presents, to determine whether they fit general assistance medical care or whether they should fit into one of those other programs. That actually takes care of about 50% of the costs of general assistance medical care. So I definitely favored the fix to allow hospitals to route patients to the most effective program as compared to by default having to put them into general assistance medical care. So that was one component. The other was hospitals really had no choice but to see these people in the emergency room and provide them, frankly, what is the most expensive type of care. So another fix in the new GAMC program is the ability for hospitals to coordinate their care more effectively, not have to simply see them in the emergency room or admit them to the hospital, but to route them to the most effective care. And then the third component was a prescription drug benefit. So that allows the hospitals a more effective way from a medication standpoint to treat these folks. And that's really critical. A lot of these folks are really down and out. They're homeless, they're mentally ill. Keeping them on their medications is a really important part of a preventive care scheme for those folks so that they don't present in the emergency room with big problems, but they can manage their care. So those three components were the main elements of the reform. I supported that. It actually reduces our costs by 75%, believe it or not, in large part because people can be routed to the right program. So I did support that and voted for it off of the House floor. Probably not the work per se, but the values of Minnesotans and kind of the values of the good people of Edina. That I get to go over to St. Paul and represent our community is an honor, something that I never take for granted every day when I drive up to the Capitol and realize that I get to come down here and represent Edina and try and do good things for Minnesota. That's what motivates me, and it's really the good folks back here at home that I'm hopefully serving as best I can. That's really the motivation.